Please subscribe to my channel and do hit the bell icon. To all dear students, so today we shall be discussing about sulfonamides antibiotics. So as we know, sulfonamides were the first antimicrobial agents effective against pyogenic bacterial infection. Next little bit we'll be talking about a history about this sulfonamide. So this thing you can see on the screen, a red color bottle, it is a dye known as Prontosil red dye. Now this is a mice who is suffering from streptococcal infection, and so experimental purpose this mouse was given Prontosil dye, and guess what? He became absolutely alright. So the credit goes to Domac who performed this experiment. Subsequently, there was an infant who was suffering from Staphylococcus septicemia, which was 100% fatal in previous days, and when this infant was given Prontosil, even he was cured. Later, in 1937, it became clear that Prontosil it was broken down in the body to release sulfonilamide, which was the active antibacterial agent in this compound Prontosil. Next, a large number of sulfonamide were produced and they were used extensively in subsequent years. But because of rapid emergence of bacterial resistance and availability of many safer and more effective antibiotics, their current utility is limited, except in their combination with trimethoprim as cotrimoxazole or pyrimethamine for malaria. Next, we'll check out chemistry of these sulfonamides. Now, you know what is this? A ring with 6 sides? Yes, you're right, this is our benzene ring. Now, on this benzene ring, at fourth position, which we also called it as para position, here you are adding an H2, that is amino group added on the para position. So, the name will become para amino benzene. Next, on position number 1, we are adding sulfo with amino group. So the name is sulfonamide. Okay, so para amino benzene sulfonamide, or simply we can call it as sulfonilamide. So all sulfonamides may be considered to be a derivative of sulfonilamide, that is para amino sulfonamide. Next, on this first amino group, here it governs solubility, potency and pharmacokinetic property, and the amino group present at the fourth position, it is required for antibacterial activity. Now this is our sulfonilamide which we saw just now, and this is another compound which is looking almost similar to your sulfonilamide. The name of this second compound is PAVA. Okay, so you can see there is some kind of structural similarity, to which we call that as structural analog. That means these two compounds are competitive antagonists of one another. So any of the compound, if they want to produce their action, they should be available in higher amount than the other. Okay, means at the reaction site, if suppose at the reaction site the concentration of sulfonilamide is more than PAVA, then sulfonilamide will produce its action. But if the concentration of PAVA is more than sulfonilamide, means PAVA will produce the action and the action of sulfonilamide will be suppressed. Next, classification, which is very simple. The first class is short acting drug, which is for amount of 4 to 8 hours. We have got just one drug, that is sulfadiazine. For intermediate acting, we have got again one example, sulfamethoxazole. Long acting sulfonilamides, we have got two drugs, sulfadoxine and sulfamethopirazine. Special purpose sulfonamides are 4: sulfacetamide sodium, mefanide, sulfadiazine and sulfasalazine. Next, we'll talk about the mechanism of action of sulfonamides. So mechanism of action is very much simple. What these sulfonamides does, they will inhibit the synthesis of folates in bacterial organism. Okay. See, when we talk about us, about human beings, we do not synthesize folic acid inside our body. Instead, we get it from our normal diet. Similarly, we have got like a few bacteria. We can divide bacteria into two types. The first type is the bacteria that will get folic acid from the medium, and second are the bacteria that has to synthesize folic acid inside our body. Means they will not get it in prepared form. They required to prepare folic acid by themselves. So our drug sulfonamide, it will mainly attack the bacteria that are synthesizing the folic acid, and what they will do, they will inhibit the synthesis of folic acid inside the bacteria, because of which it will be inhibiting the bacteria. Okay, so this is a simple mechanism of action. They mainly act by inhibiting the folates or folic acid synthesis in the bacterial organisms. So first of all, suppose this is your bacteria. First of all, we shall check out what is the normal physiology occurring inside the bacteria, and then we will see what will happen to the bacteria when we consume sulfonamide antibiotic. Okay, so suppose this is your bacteria, and the important things present inside the bacteria are, we have got a pteridine precursor, and second thing is glutamate. Okay, we have got two important things, material, or you can say raw material, required for the synthesis of folic acid: pteridine precursor and glutamate. Next, it have got two important enzymes. One is red enzyme, second one is purple enzyme. The name of red enzyme is dihydropteroate synthetase. The name of purple enzyme is dihydrofolate reductase. Next, one important thing which is present in the medium is PABA. So what this bacteria will do is, it will take glutamate in one hand and it will try to mix it with pteridine precursor. Next, with second hand, this bacteria will catch PABA from the medium and it will move it inside its body and try to mix three of these things. And it was not mixing, so the red enzyme said that, wait, I will come and try to mix it. Okay, so this red enzyme will come and it will try to mix. So what it will try to mix? It will try to mix pteridine precursor, glutamate and PABA, and this enzyme mixes it and it will result in the formation of a compound known as, the name of this compound is dihydrofolic acid. Okay, so dihydropteroate synthetase will lead to synthesis of dihydrofolic acid. Next, this purple enzyme is also there, so it is also having got some role. So what this purple enzyme will do, it will act on this dihydrofolic acid, and this purple enzyme, that is our dihydrofolate reductase, it will convert dihydrofolic acid into tetrahydrofolic acid. And now this tetrahydrofolic acid is utilized in the synthesis of purines and DNA. That means this folic acid is required for the normal growth of the bacteria. Okay, so this is the normal thing that happens in the body of the bacteria. Next, we shall check out what happens when this bacteria interacts with sulfonamides. Okay, so the problem mainly occurs over here, that is our PABA. Why problem mainly occurs over here means, because we have got a structural analog of PABA, that is our sulfonamides. Okay, and bacteria does not know, he is unaware of this thing, this structural analog problem. So normally what it was doing, it was taking glutamate and mixing it with pteridine, and with another hand it was taking PABA. But instead of PABA, because of structural similarity, it will by mistake catch sulfonamides and it will take sulfonamide inside it and try to mix it. And red enzyme will be also coming for the rescue. But now what this sulfonamide will do, this sulfonamide will start inhibiting this red enzyme, that is dihydropteroate synthetase, and it will eventually kill this enzyme. Okay, so what is the action of sulfonamide? Basically, because of structural similarity, it will be moved inside the bacteria, and what role this sulfonamide is having, it will inhibit the enzyme, that is red enzyme, and the name of the red enzyme is dihydropteroate synthetase. Okay, because of which there won't be any dihydrofolic acid synthesis. So this action is said to be bacteriostatic action. Okay, so it is inhibiting the growth of the bacteria. Okay, our sulfonamide, it is not killing the bacteria, it does not have any cidal action, it is have got bacteriostatic action. Okay, so how it is doing, what it is doing, it is inhibiting the enzyme dihydropteroate synthetase. Okay, next we have got two more important drugs, that is trimethoprim and pyrimethamine. Okay, sulfonamides. Apart from this, we have got two more drugs, and what these two drugs will be doing, it will be attacking this purple enzyme, that is dihydrofolate reductase. Okay, and what it will be doing, it will be inhibiting this enzyme. Okay, so again it have got a bacteriostatic action. Okay, so both sulfonamide as well as trimethoprim and pyrimethamine, all these three drugs have got bacteriostatic action. Okay, but the difference is only in the enzyme. Sulfonamide will be inhibiting dihydropteroate synthetase enzyme, whereas trimethoprim and pyrimethamine, they are inhibiting dihydrofolate reductase enzyme. Okay, so all these three drugs, when they are taken alone, they are producing bacteriostatic action. So this is about the mechanism of action of sulfonamides. Next we shall check out the pharmacokinetic of sulfonamides. First of all, talking about absorption, sulfonamides are rapidly and nearly completely absorbed from the GIT. Next, regarding distribution, sulfonamides are widely distributed in the body. They crosses blood-brain barrier and placenta. They also accumulates in prostatic fluid, and the extent of plasma protein binding, it differs. The longer acting drugs are highly protein binding. Next, regarding metabolism, the primary pathway of metabolism of sulfonamide is acetylation by acetyltransferase that occurs in the liver. The extent of metabolism differs for different members, and the acetylated derivatives are inactive, but they can contribute to various adverse effects. It is generally less soluble in acidic urine than the parent drug. Therefore, they may precipitate and cause crystalluria, which is a side effect. Next, regarding excretion. Sulfonamides are excreted mainly by the kidneys through glomerular filtration. Both renal tubular secretion and reabsorption occurs. The more the lipid-soluble members, they are highly reabsorbed in the tubule, therefore they are longer acting. Okay, so this is about the ADME, that is the pharmacokinetics of your drug sulfonamides. Next, we shall check out the antibacterial spectrum. Sulfonamides, they are primarily bacteriostatic in nature, as we have seen just now. The bactericidal concentration is basically attained in urine, and these drugs are basically effective against gram-positive as well as gram-negative bacteria. So these all are the list of the bacteria which are sensitive to sulfonamides. Next, the resistant organisms are gonococci, staphylococci, meningococci, streptococci and E. coli. And the reason for their resistance is maybe these organisms, they are producing increased amount of PABA. PABA, it is a structural analog of sulfonamide, and because of which they both have got competitive antagonism. So any organism who is producing large amount of PABA means it will displace the sulfonamide and it will itself produce its action. Second reason is maybe their folate synthase enzyme has low affinity for sulfonamides. And the third reason for the resistance development is they might have adopted an alternative pathway in folate metabolism. Okay, maybe those organisms are using some another kind of enzyme for synthesizing folic acid. Next, we shall check out the uses of sulfonamide. See, as such, systemic use of sulfonamide alone is rare now, though they can be employed for suppression therapy of chronic urinary tract infection and for gum infection. But when sulfonamides, they are combined with cotrimoxazole, in combination with cotrimoxazole, like sulfamethoxazole is used, they are basically more active for bacterial infection. Okay, so this combination we shall study in our next upcoming video. Next, afterwards, ocular sulfacetamide sodium. It is a cheap alternative in trachoma or inclusive conjunctivitis. Although additional azithromycin or tetracycline therapy is also required for eradication of the disease. Next, even topical silver sulfadiazine or mefenide are used for preventing infection on burned surfaces. So these are about the uses. Next we shall check out the adverse effect, and this adverse effect you can remember from the mnemonic sulfonamides. So S is for Stevens-Johnson syndrome. Okay, so sulfonamide can induce Stevens-Johnson syndrome problem. U is for urticaria. L is for leukopenia. F is for folic acid deficiency. Sometimes it may lead to folic acid deficiency. O is for obstruction in urinary tract, which obviously occurs because of crystalluria. But anyhow, precipitation in urine can be minimized by taking plenty of fluids and by alkalizing the urine, in which the sulfonamide and their acetylated derivatives are more soluble. Next, N is for nephritis. A is for aplastic anemia. M is for it is contraindicated with methanamine. I is for increased risk of carnecterus. Okay, so carnecterus may be precipitated in newborn, especially premature, whose blood-brain barrier is more permeable by displacement of bilirubin from plasma protein binding site. Okay, so you can see on the brain that yellow color is bilirubin occurring in the premature kids. Next, D is for drug fever. E is for eosinophilia, and S is for skin rashes. So all these are adverse effects of sulfonamides, and this was all for our today's video regarding sulfonamide. I hope you people understood this video. Thank you for watching.